Community Assessment Analysis Presentation of Kenneth City, Florida by Karen DeSatnik, Kamala Weaver, and Sarah Roby. This is a map of Kenneth City, Florida. Kenneth City started as 340 acres of pasture land. The area was developed by Sidney Colon, who named the area after his son, Kenneth Colon. The city of Kenneth City was incorporated on April 30th, 1957. In 1959, Kenneth City had 300 registered voters and more than 450 residents. Westgate Elementary School opened on November 16, 1957, which served Kenneth City as a 12-classroom school. On September 8, 1959, Dixie Hollins opened for its first school year. On December 9, 1959, Winn-Dixie opened in Kenneth City Plaza. The police department was established on February 1, 1960. Kenneth City was home to the nation's first condominium. Clearview Oaks was conceived in 1959 by the developer Sidney Colon. Kenneth City now covers over 467 acres and has a population of just under 5,000 residents.
The housing of Kenneth City is composed of single and multifamily homes, as well as apartments and condominiums. The general appearance of the homes varies from well-kept and updated to run-down and outdated. The median year that the homes were built within the city is 1963. The housing options do appear to be adequate to meet the needs of the population of the town. There are low-income housing options available within the city. Options include Shady Oaks apartment homes, which provides housing to low-income families. There are also homeless shelters available within the city as well as neighboring communities that provide shelter to Kenneth City residents. For schools, Blanton Elementary School and Dixie Hollins High School are both located within Kenneth City. For middle school, the children attend Pinellas Park Middle School in the neighboring city. There are multiple parks and recreation options available to the residents of Kenneth City, including James P. Ernest Park and Carl Schleck Park, which are both located within Kenneth City boundaries. There are issues related to the structure of the community which were observed during our windshield survey. These issues include abandoned properties which are now being used for illegal activity and run-down properties or non-code compliant homes that are most often inhabited by elderly or poor individuals who cannot handle the upkeep or care necessary to keep these homes code compliant. The city has put together the Care Fund, which assists residents who need financial assistance with basic housing needs. This county has also stepped in to assist with condemning or securing abandoned homes to reduce the amount of illegal activity.
Kenneth City has a population of 5,026 residents and a population density of 7,018 residents per square mile. Population changes in the last 10 years reflect a 5.8% increase. Kenneth City residents are predominantly of the Caucasian race, and the biggest age group residing in Kenneth City is made up of the 24 to 64-year-old age group at 51.9% of the population. The highest level of education is the high school graduate at 40.16%, and the family income is predominantly of the middle income class at 49.5%. Cancer and heart disease remain at the top of the list for leading causes of death among the residents of Kenneth City, with 22.8% of deaths caused by cancer and 22.7% of deaths caused by heart disease. Not only are cancer and heart disease leading causes of death for the residents of Kenneth City, but for the United States in general. Observed behaviors among the citizens of Kenneth City contributing to these causes of death include lack of exercise, poor diet, and tobacco use. The top communicable diseases encountered among the residents of Kenneth City include chlamydia and gonorrhea. Not only are these two communicable diseases high on the list for the residents of Kenneth City, but they are high on the list statewide. In 2013, Florida reported 77,890 confirmed and probable cases of chlamydia and 19,554 confirmed and probable cases of gonorrhea. Kenneth City offers many health-related resources. The residents of Kenneth City have access to 37 acute care facilities within a 60-mile radius and an average emergency room wait time of 26.5 minutes. In addition to the acute care facilities, they also have access to the Pinellas County Health Department, offering services in primary care, dental, laboratory, triage, family planning, and immunization. The Pinellas County Health Department is open on Monday through Friday from 8 a.m. until 5 p.m. They also have access to the Lexington Health and Rehabilitation Center and the Jacaranda Manor, offering a 291-bed skilled nursing facility specializing in mental health. Social services offered in the area include the Sunshine Senior Center, the Alpha House of Pinellas County, offering homeless pregnant women services, and the Suncoast Center, offering services to the citizens of Kenneth City, including behavioral health, child abuse, and family stability. Parks and recreational opportunities can be found throughout Kenneth City, including county parks, the YMCA of Greater St. Petersburg, and residential parks for those residents without the transportation to get to the city parks. The city parks offer adult fitness zones, water fountains for hydration, quiet shaded areas for picnic lunches or meditation, playground equipment for children. They are free of cost and are open from 7 a.m. until dusk, 7 days a week. Food commodities offered in the area include the Winn-Dixie Supermarket on 54th Avenue, open from 8 a.m. until 10 p.m. daily. The Heavens Works Food Pantry, located just outside of the city limits, providing food and necessities, open 2 Thursdays a month from 5 p.m. until 8 p.m. And Graham's Produce Market, located within the city limits, offering a large selection of fresh produce at reasonable prices with readily available coupons, open Monday through Sunday from 8 a.m. until 6 p.m.
Kenneth City Community Hall is located on 58th Street North and offers social clubs, game nights, potluck dinner, and Zumba classes to its residents. There's James P. Ernst Park, which is located right next to the community hall and offers a playground, basketball courts, tennis court, adult fitness areas, and other recreational options. Carl Schleck Park is located right next to the town hall. Police services are provided by Kenneth City Police Department, and they provide community outreach programs such as Walk with a Cop to provide exercise and outside activities to the community, as well as allowing the residents to interact with these officers in a casual setting. Fire department and EMS services are provided through a partnership with the Pinellas Park Fire Department. There are environmental programs in place, such as the use of reclaimed water and curbside recycling, which are provided through partnerships with Tampa Bay Water and Progressive Waste Solutions. There are some concerns with some of the environmental factors of the city of Kenneth City. These include its roadways, bike lanes, and sidewalks. There are very minimal bike lanes offered within the community. Many of the community's residents do use bikes to get around as their main mode of transportation. There are no sidewalks on the side streets of the community, and on the main roads, many of the sidewalks come to abrupt stops or are very confusing in their pathways along the road. Many of the roadways are narrow and difficult to navigate within the community.
Kenneth City's government structure is composed of public officials, including a mayor responsible for the enforcement of city laws and recommendation for legislative action to the council members, a vice mayor responsible for acting in the place of the mayor if the mayor is absent and assisting with mayoral duties, council members sharing the responsibility of supervising elected administrative officials, policy formation, voting on city matters, and attending council meetings, a town manager responsible for the appointment and necessary removal of all town officers and town employees, other duties including preparing the budget as well as an end of fiscal year report, including information of finances and administrative activities regarding the previous year and submitting it to the town council members. A town clerk responsible for notifying the public and council members of upcoming meetings, attending the meetings, and maintaining a record of topics discussed, as well as the custodian of all records, documents, and papers. And a town deputy clerk responsible for directing the complaints of the town residents to appropriate people and departments, as well as clerical and bookkeeping duties. Funding sources for Kenneth City come from franchise fees, sales taxes, license and permits, intergovernmental revenue, red light camera revenue, fines, charges for services, and miscellaneous items, and budget allocation of funded sources are for general government, public safety, transportation, parks and recreation, red light camera expenses, human services, and miscellaneous items.
Cancer is the leading cause of death in Kenneth City, with 22.8% of deaths annually. Instances of cancer can be attributed to the sun exposure experienced in the sunny Florida weather, as well as cigarette smoking. Heart disease is the second leading cause of death within Kenneth City, with 22.7% of deaths annually. It also is the leading cause of death in the United States. There are lifestyle changes that can be made to decrease the risk of heart disease. Smoking is a very large problem in Kenneth City. During our windshield survey, several members of the community were observed smoking. Smoking can lead to cancer, stroke, and other health conditions, and it also increases the amount of litter on the streets. Substance abuse is a large issue within the area. An observation of the local emergency rooms showed several situations of overdoses or other drug-related complications. Substance abuse wastes city resources and also correlates with other crime problems within the area. Sexually transmitted diseases are also a large problem within the community. 4 out of the top 5 communicable diseases in the area are sexually transmitted diseases. Noncompliance is also seen as a major issue. This made the list because of its effect on the overall health of the community and the healthcare costs associated with it, as well as the use of resources